Good day, folks. Thank you for joining us here at Your Health. On today's program, we have updates on vitamin D. We're going to go through all the newest research on the health benefits of vitamin D, plus what can go wrong. What happens when you're deficient in vitamin D? There's a lot of material to cover today, so we're going to get right to the news. Let's go to the news. Let's see what's happening in the health world. Women who have diabetes are more likely to also have heart disease than men with diabetes. The new review and meta-analysis of 64 previous studies involving more than 850,000 subjects finds when women have diabetes, they are 3 times more likely to develop coronary artery disease than women without diabetes. Men with diabetes are twice as likely to develop heart disease. This makes women with diabetes about 40% more likely to develop heart disease than a man. Previous research from the same team found women with diabetes are 25% more likely to have a stroke than men with diabetes. The study was conducted at the University of Queensland and published in Diabetologia. Folks, you know, the real storyline from this research is not that women with diabetes are so much more likely to have cardiovascular disease than men with diabetes. The real story here is type 2 diabetes greatly increases the risk of cardiovascular disease in anyone who develops it, be they a man or a woman. Women with diabetes are 3 times more likely, while men with diabetes are twice as likely to develop coronary artery disease. Also from previous research, women with diabetes are at greatly increased risk for stroke, so are men, but women are a little bit more likely, about 25% more likely than men. But both are at substantial risk for stroke. You know, oftentimes an increased relative risk of a disease can be deceptive. For example, if we are at twice the risk of a certain disease, it may sound impressive, but if the disease only strikes 1 in 1,000, being at twice the risk only increases your chances to 1 in 500 of developing the disease. So that's still pretty slim odds. But with cardiovascular disease, understand that every other American dies from some form of cardiovascular disease. So if your risk of cardiovascular disease is doubled or tripled, it creates a scenario where it is highly likely that you will eventually have a stroke or a heart attack. So yes, this one is critically important. So much so that let's put it in another way. If you are diabetic, you have only a 1 in 3 chance if you're a woman, or a 1 in 2 chance if you're a man, of not developing cardiovascular disease. Pretty dismal odds, aren't they? Experts in diabetes tells us that about 75% of all cases of type 2 diabetes are preventable with a healthy diet and a pattern of regular exercise. They also tell us type 2 diabetes can be reversed in about the same percent. This means developing diabetes is not like the lottery, a question of simply beating the odds, but rather a question of lifestyle practices and lifestyle choices. Seniors, if you engage in regular exercise, you are less likely to become disabled. Researchers from the University of Florida followed over 1,600 seniors for over 2.5 years for the Lifestyle Interventions in Independence for Elders study. Half of the seniors walked for 150 minutes a week. They also engaged in strength, flexibility, and balance training. The other half simply stretched on a regular basis. They found that regular exercise was the most significant factor in determining whether the senior remained active or became housebound due to physical disability. The active seniors were able to walk at an 18% quicker pace. They were also at a 28% reduced risk of disability overall. The researchers also found that for seniors that regularly walked, if they had an injury or a fall, they were about 30% less likely to become disabled from the injury. Related research from Yeshiva University finds regular exercise is the only lifestyle practice that protects overweight women from becoming at risk for heart disease. The study was published in the Journal of Clinical Endocrinology and Metabolism. Last one first on this set. The study from Yeshiva University found They followed 900 overweight middle-aged women for 7 years. They found that engaging in regular exercise was the only lifestyle practice that helped to protect these women from developing multiple risk factors for cardiovascular disease. So for example, let's say a woman age 45 starts the study with being overweight, her only risk factor for cardiovascular disease. This study found if she did not exercise, she was very likely to also develop hypertension, elevated glucose blood levels, and even elevated cholesterol levels, all major risk factors for cardiovascular disease. But if she exercised regularly, she did not go on to develop these extra risk factors for catastrophic heart disease or stroke. Keep in mind, regular exercise was the effective way to prevent cardiovascular disease. And our first study finds regular exercise is the key lifestyle practice that keeps seniors physically fit. while it helps them avoid disability. Also, an often underappreciated benefit of regular exercise is how it helps you overcome injury. If you should sustain a fall or an accident, if you exercise regularly, you are much more likely to return to full activity. And I find that simply amazing. File these two studies under things no one can do for you: exercise. Today on Your Health, we'd like to discuss the newest findings on vitamin D. I hope every one of you are taking your vitamin D. If not, I'm sure that after what you learned from this program, you will. Today it's D3. We'll be right back. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. And today, when you buy one bottle of vitamin D at the regular price, you'll receive a second bottle free. That's right, buy one and get one free.
Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
That's special once again. Today only, when you buy one bottle of vitamin D at the regular price, you'll receive a second one free. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128 or order online at bioinnovations.net. Ask about the auto-ship program for additional savings.
I'm Cindy Becker, and this is Your Health at a Glance. Do you want to maintain your mental clarity? With people living longer, we need more research into the ways to lower the risk of dementia. Studies are showing us that people who regularly read books, complete puzzles, or solve word games like the Sunday crossword puzzle maintain their mental abilities longer than people who don't. We also preserve memory by maintaining social activities, such as volunteering, attending religious services, or regularly talking with friends and neighbors. And diet plays a big role as well. It's important to eat a nutritious diet free from heavy metals and chemical pollutants, and full of vitamins and the essential fatty acids which power the brain. These simple and important steps will help keep you mentally healthy for many years to come. For Your Health at a Glance, I'm Cindy Becker.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the auto-ship program for additional savings. Welcome back, everyone. It is such a blessing to be with you today. Well, today's show is going to be fantastic. You've got to sit back and watch this one. Don't try to take notes. There's too much information to write down. We're talking about vitamin D. We've talked about vitamin D before, and now you're seeing it in a lot of food products. You're seeing it all over the media. But you're going to find out today new research, and you're going to find out maybe you thought you were taking the right amount of vitamin D, but maybe you really weren't. This one's going to be great. So sit back and listen. Now, Richard, vitamin D, there's just so much. I know that there's a lot to cover today. But I think for everyone, once they find out all the new research about what it does, one of the take-home messages that I want everyone to really get a hold and a grasp on is how much should I take?
Yeah, and we will answer that question as precisely and accurately as possible. Okay?
Good.
Well, let's talk about vitamin D. What is vitamin D? It is a fat-soluble vitamin, helps to control the absorption of the minerals calcium, magnesium, iron, phosphorus, and zinc, either directly or indirectly. It deposits calcium into the bone, and it also controls the immune system and the growth of cells. That's the broad over category. But also, vitamin D is a hormone that regulates other hormones. Okay? The body can make it from sunlight and 7-dihydrocholesterol in the skin. We can make our own vitamin D. This dual function makes vitamin D physiology complex, and this complexity has delayed its discovery and full understanding of its role in good health. Dietary and self-made vitamin D is inactive. It has to be activated, and that's a complex process in and of itself. It must be processed by the liver and by the kidney into calcitriol, or 1,25-dihydroxycholecalciferol, before it can do its varied jobs. What we call vitamin D2 is made by plants. That's vegetarian, that's vegan, okay? Vitamin D3 is made by animals. So the vegan might want to use D2, but it's not as active. Vitamin D3 has up to 90% more potency than D2, plus all this new research is being done on D3. So if you're using D2, it's a bit of a leap of faith, okay? So D3 is the best to take. It's more potent, and it is the one associated with reduced risk of death from all causes. Both D2 and D3 are converted into the active form of vitamin D. That's 1,25-dihydroxycholecalciferol. But 25-hydroxycholecalciferol, without the one, just 25-hydroxycholecalciferol is the storage and tested form. So if you were to go to the doctor, the 25-hydroxycholecalciferol is the test you would want to have done to see what your vitamin D levels are. And we have that on the screen for you, and we'll leave it there for a second or two so you can write that down. This is about education and helping you get the right test. 25-hydroxycholecalciferol is the one you store and the one you test to see how you're doing with your levels, okay? When D is made the natural way from sun exposure, our body controls its production. When we bypass that process and supplement vitamin D, which you must do to attain therapeutic levels to this full benefit, we lose that natural control. So it's imperative that we know what we're doing when we bypass natural controls. Does that make sense? Because it's an important point, because vitamin D is fat soluble and there is a toxic level, but it is extremely high, all right? Well, what is the state of vitamin D in America? It's a state of confusion, really. It truly is. It takes a lot of study to sort all this out. The number of factors have created confusion regarding vitamin D in health. The aforementioned dual function, its action as a vitamin and a hormone. They use different units of measure. We have international units, we have micrograms, we have nanograms, nanomoles. I mean, it just, you know, you need a chemistry degree to understand all this. Well, try to ignore that stuff because we'll simplify it as best we can. It's not that hard. Also, we have ubiquity in nature. You can find it in foods, and we find it in diet. It's supplemented in our diets. The massive amount of data. There's over 60,000 research articles at the PubMed, National Institutes of Health, available to anybody who wants to review their summaries. In the last 2 years, we've had over 15,000 new studies, so that makes it hard for even the experts to keep up on, and we have 830 double-blind placebo-controlled studies. So what I did for this talk, I went through the last 100 double-blind placebo-controlled studies. We're bringing you those results. So in the interest of time, I'm not going to reference every single one of them. You can go to PubMed and look. Look for yourself. This is where we found this fascinating information. There is undeniable evidence that many are low in vitamin D and the majority of Americans are frankly deficient. And there is suffering because of this fact. And it can be prevented with a 10-cent pill, okay? The biggest controversy lies not in whether we should supplement vitamin D, but how much should we supplement, okay? The majority of studies that do not confirm vitamin D's benefits use too low a dose, or they used it for too short a time, okay? The Institutes of Medicine have further created confusion by recommending only 600 international units a day for adults. I'm going to tell you right now, that is grossly wrong. It is nowhere near enough to provide you with all the benefits of vitamin D. It'll prevent rickets. It'll prevent osteomalacia, the bone disease in adults. Rickets is in the child, okay? But it's not enough to prevent heart disease, diabetes, cancer, okay? Vitamin D experts recommend that we take between 3,000 and 8,000 international units of D3 every day. Now, what is vitamin D deficiency? The old standard was below 10 nanograms is frank deficiency. Below 20 nanograms, this is your blood level, is insufficient. The newer recommendations is we want above 40 for optimal. Below 34 is insufficient, and below 20 is deficient. So we're raising what we call deficiency. You need more because we know more about it, all right? Only 20% of those tested are in the sufficiency level. 80% of us are low, leading to diseases that can be prevented, okay? Levels as low as 10 nanograms will prevent rickets, it'll prevent osteomalacia, but it will not protect you from the common diseases of our time. What is the ideal? Now, oftentimes we come to this rather quickly. Well, what if natural man were allowed to control his vitamin D purely from sun exposure? What level would that make? Maybe that would answer the question. Well, they did this study in Hawaii. It's called the Hawaiian Professional Surfer Study. Let's assume, it's a good assumption, the professional Hawaiian surfers in the sun virtually every day. They're exposed to as much sun as any human on the planet. They only attain a level of 27 nanograms, not enough to confer protection from these major diseases. Our bodies tan. We use sunscreen. We put covers on. I've surfed with those surfers in Hawaii. You have too, honey. You see what they do. They protect from the sun. Nobody wants to get burned. So even in the natural state, it's not enough. See, this is another bit of evidence that tells us we must supplement to get adequate levels to protect us, okay? Who is likely to be deficient? Boston University, 82% of us are deficient or insufficient in vitamin D. 82%. 80% of nursing home residents, 70% of psychogeriatric. I'm talking about Alzheimer's disease, Parkinson's disease. 70% are too low. 92% of children, especially bottle-fed children. Dark complexion, 85% of African American senior women are so low in vitamin D, it raises their disease index dramatically. If you live in northern latitudes, if you're north of LA, and that doesn't seem very north, does it? North of LA, north of Atlanta, that line basically, you are much more likely to be deficient in vitamin D. Those who wear sunscreen, work indoors, eat very little dairy, have malabsorptive issues, meaning chronic diarrhea, chronic loose stool. You're not absorbing your nutrients. If you are obese, vitamin D filtrates into and stored in the fat. It's trapped, it's inactive. The obese needs higher levels, okay? Those with hyperparathyroidism, those taking certain medications like steroids, prednisone, inhalers even, topical steroids, systemic steroids, it depletes vitamin D. Chemotherapy for cancer, barbiturates, phenytoin, seizure control medicines. You know, one of the classic signs of profound vitamin D deficiency is seizure. Imagine taking 2, 3, 4, 5 seizure medicines to control your epilepsy when really what you need to do is take vitamin D. You're just making the problem worse and worse. Can you imagine that scenario? That's going on right now in America. You need to take your vitamin D. It could cut that cycle just tremendously. Rifampin, isoniazid, these are tuberculosis drugs. It's hard to beat TB if you're low in D. And the medicines we use to kill the TB germ deplete your vitamin D even more. No wonder we have resistance to TB. No wonder. Cholestyramine. These are medicines to lower cholesterol, mineral oil, Orlistat, the dietary supplement that is an oil. Now, let's go to our break here, but let's talk about next, what happens if you get too much? We got to know that when we return. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. And today, when you buy one bottle of vitamin D at the regular price, you'll receive a second bottle free. That's right, buy one and get one free.
Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
That's special once again. Today only, when you buy one bottle of vitamin D at the regular price, you'll receive a second one free.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128 or order online at bioinnovations.net. Ask about the AutoShip program for additional savings.
We have all said, I need to get some exercise, but how many of us put on our walking shoes and go? I'm Dr. Richard Becker with Your Health at a Glance. Learning a little more about the health benefits of exercise may help you get motivated to lace up your walking shoes. Exercise helps to control our appetite and our weight. It maintains strong muscles and a good figure. It promotes the release of endorphins that counter depression while helping us feel good about our lives. Exercise helps to lower blood glucose while reducing our risk for cardiovascular disease. Exercise promotes a strong circulatory system while reducing our cholesterol. Exercise even helps us to get a good night's sleep. Recent research confirms just 30 minutes of walking 3 or 4 times a week is enough to achieve all these wonderful health benefits. Just 30 minutes a day. It's a small price to pay when you have so much to gain from exercise. I'm Dr. Richard Becker for Your Health at a Glance.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastro-defense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone, talking about the importance of vitamin D in our life, in our health. Isn't this just amazing information? Now, Richard, that was a lot on vitamin D.
Yes.
But now we're going to talk about what happens when we don't get enough.
Yeah. If it's okay, let's first talk about if we get too much. Okay, the first thing. Do you want to do that?
Sure.
Okay. You can get too much vitamin D, and it's important to understand that. If your blood level's above 80 nanograms per milliliter, it may increase your calcium levels. And at 100 nanograms, it can create atrial fibrillation in some people. But to do that requires 40,000 units a day for extended periods of time. So the higher the blood level, of course, much more vitamin D must be used. Most people who try this, in many studies you'll find, they just don't take enough for long enough to get the desired benefit. The overdose is the rare occurrence. One study, 21 days of 4,000 units, did not help eczema. And when we know vitamin D helps eczema, but they didn't do it long enough and enough. Now, what does vitamin D deficiency, what role does it play in our health? In Britain, they did a study, vitamin D insufficiency raises all-cause mortality, death from any reason for everybody, by 75%. You're 75% more likely to die today, tomorrow, this year, if you're low in vitamin D, from any cause. Isn't that amazing? Boston University finds vitamin D significantly affects 291 genes, 160 biochemical pathways that affect cancer, autoimmunity disease, cardiovascular disease, diabetes, okay? And they've been able to explain the biochemical mechanisms that it does this. Dr. Hollick, one of the world's leading authorities in vitamin D, he recently announced that some 2,000 genes are affected by vitamin D. That is fully 1/6 of our genetic code, either directly or indirectly, is influenced by vitamin D. Every cell tested in the human body so far has a vitamin D receptor. Get that. So yes, the implications are profound. Norwegian researchers found if you're low on vitamin D, if you're below 32, you're 63% more likely, I got it backwards. If you're above 32, you have higher levels, you're 63% more likely to survive breast cancer, 60% more likely to survive colorectal cancer, 67% more likely to survive leukemia and lymphomas, 81% more likely to survive lung cancer, 76% more likely to survive prostate cancer, 15% more likely to survive head and neck cancers, one of the most difficult of all cancers to treat. A British study found for every 8-point increase of vitamin D, your risk of dying from melanoma decreases 17%. Also very difficult to treat disease. Vitamin D also lowers cancer risk. Breast cancer, 70% of breast cancer patients have low vitamin D levels. The median, the typical vitamin D level of an American breast cancer patient is 17. No wonder we're seeing so many more breast cancer deaths. Austrian study, vitamin D insufficiency tied to a 250% increased breast cancer risk. 250 just from vitamin D. D-supplementation lowers muscle and joint pain during chemotherapy for breast cancer. You're more likely, 60% more likely to be alive in 5 years if you've had breast cancer. See, this is important. Colorectal deficiency of D suppresses the release of immune proteins that stop the growth of colon cancer. They've explained. It isn't just an association study. They have the biochemical pathways now knowing how this works. Lung, Denmark study. All the cancers associated with smoking, which is lung, bladder, esophagus, cervical, head and neck, kidney, liver, pancreas, you know, all these cancers associated with tobacco, they drop remarkably if you are taking vitamin D. So until you can quit smoking, please start your vitamin D. Lymphomas and leukemias, deficiency leads to 40% higher mortality for large B-cell lymphoma. Also, very aggressive cell type in lymphomas and leukemias when you're vitamin D deficient. Those with chronic lymphocytic leukemia, CLL as they call it, and vitamin D deficiency are twice the risk of rapidly progressive disease and death. Prostate, those with high vitamin D levels are 57% less likely to develop fatal prostate cancer. 2/3 of low-risk prostate cancer patients, they had a stalling. It completely stopped their disease when they improved their vitamin D level. 4,000 units a day stopped the progression of the low-risk prostate cancer types. Skin cancer, patients who avoid the sun are 3 times more likely to be deficient in vitamin D. Finnish researchers report if we doubled our sun exposure, it would save 10 times the number of lives that we would lose from skin cancers, just from boosting up the vitamin D level, okay? Now, folks, I want to ask you a question. What would happen if entire America took enough D to prevent these diseases? What would happen to the cancer industry in America? They wouldn't have a lot to do, would they? Think about that for a minute and the implications of that. I'm just saying, think about it. Immune function. All right, this is a mouthful, but you got to hear this because this is the basics of vitamin D. I'll interpret as we go. This is what vitamin D does for our body. It activates monocytes, turning them into macrophages, and activates these cells into action, thus turning on T cells. That's immune activation. It turns on the immune system. Vitamin D does that. Improves cell-regulated immunity. Inhibits needless lymphocyte, immunoglobulin, and cytokine proliferation or synthesis. That means it controls autoimmunity. That means your immune system is less likely to turn on itself and cause rheumatic disease, lupus, autoimmune disease, this type of thing. It inhibits type 1 cytokine secreting T helper response while activating T2 response, T helper 2 response. That's allergies. That's asthma. That's eczema. Your immune system doesn't react inappropriately and cause you atopic, you know, allergies and asthma. It modulates timely apoptosis. That's cancer prevention. Okay? It modulates appropriate immune response, transcription factor activation. This means it's the right response for the right problem. Have you ever heard of this scenario where you catch a cold and you develop a rash, or you catch a virus and you get arthritis from it, or a bacterial infection, you develop an arthritic process? We don't want our immune system to attack the wrong thing. Vitamin D regulates that. Isn't that amazing? Who knew? This is amazing. This is all from the World Journal of Gastroenterology. Anybody can review that. We also know that vitamin D deficiency disturbs immune balance, promoting autoimmune disease. That's your misdirected killer T cells. and leads to things such like multiple sclerosis, terrible disease, inflammatory bowel disease, rheumatoid arthritis, and insulin-dependent diabetes, and the inflammation of type 2 diabetes. All this is because we're not getting enough vitamin D. A study of 187,000 found those with the highest levels of vitamin D were 40% lower risk of multiple sclerosis. Also, pregnant women with high vitamin D levels have babies who are at lower risk of multiple sclerosis. Half of all rheumatic disease patients who present to the clinic, to the doctors, the specialty offices, rheumatoid arthritis, psoriatic arthritis, they're low in D. 99% of all lupus patients are low in D. 99%. Doesn't have to be that way. 2,000 units a day decreases the activity of these autoimmune diseases. Can you believe this? Can you believe the impact on America if we got on a program for everybody? We have more. After the break, we're going to talk about cardiovascular disease, neurologic effects, musculoskeletal, and diabetes. Can taking vitamin D help your diabetes? Stay tuned. You'll learn that too. Be right back. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why Bioinnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Our health depends on the choices we make every day, and few conditions are as dependent on our choices as diabetes. So here is your daily diabetic checklist. Number 1, take your diet seriously every day. Eat lean protein and leafy vegetables. Number 2, sugars and starches raise blood glucose, so reduce them in your diet. Number 3, check your blood glucose and record the readings every day. Number 4, take your medication daily and don't skip. And number 5, try to exercise every day. It will help you take off weight, which will help your body regulate blood sugar better. If you are diabetic, this is your quick daily checklist that could make life better. For Your Health at a Glance, I'm Dr. Richard Becker. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient.
Bioinnovations brings you Dr. Becker's Bionutrients Vitamin D3. And today, when you buy 1 bottle of vitamin D at the regular price, you'll receive a second bottle free. That's right, buy 1 and get 1 free.
Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
That's special once again. Today only, when you buy 1 bottle of vitamin D at the regular price, you'll receive a second one free. Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128 or order online at bioinnovations.net. Ask about the AutoShip program for additional savings.
We're back, everyone, talking about the importance of vitamin D. This is just such amazing information, and to help you get the vitamin D you need in your nutritional plan, here's what we have for you today. This is fantastic. Not only are we going to be doing the buy 1, get 1 free on our vitamin, this is the Dr. Becker's Bionutrients Vitamin D3 1000 IUs. We now have the new 5,000 IU size. That will help you not have to take so many tiny little pills to get that level where you need it to be. So it's going to be buy one, get one free on either the 1,000 IU or the 5,000 IU size, whichever one that you want that fits your needs. Now, Richard, you had a couple of more studies on immunity.
We were talking about immune function, and I wanted to be sure and get into the fact that vitamin D helps asthma. We have so many more asthmatics today. The death rate from asthma, the acute attacks, these are all on the increase, and we need to do something about this. Vitamin D helps to prevent the occurrence of asthma. If you are low in vitamin D, you're 260% more likely to develop asthma. Okay? And if you are asthmatic, if you can get your blood level of vitamin D above 42 nanograms, you're going to see half the number of attacks, half the severity of symptoms, and reduced dependency on inhaled corticosteroids. That study, published in JAMA just recently, reported that vitamin D didn't help. You had to ferret out the truth because in their results, they included those who did not comply and those who are overweight, obese, and using high level of steroids that did not attain a higher level. But if you go by correlation to drug level, vitamin D level in the bloodstream, above 42 reduces your asthma symptoms. Now, why would they report it the other way? I'm going to let you ponder as to why. It might help you to learn that a pharmaceutical company was involved somehow, some way. Yeah, okay. Let's talk about cardiovascular disease. University of Colorado, seniors with low D are 3 times more likely to die from heart disease and 2.5 times more likely to die from any cause. Seniors, you worked all your life for these years. Keep your D level up and you'll have a better chance of enjoying it. The Women's Health Initiative found that as little as 400 international units of D help to improve lipid profile and cardiovascular disease risk, but you need more than 400. When you're low in D, it causes your arteries to stiffen. It clogs the arteries. It causes poor vascular function, endothelial dysfunction, higher cholesterol levels, 40% more likely to have angina, chest pain, 64% more likely to have a heart attack, 66% more likely to have a high blood pressure, and it tends to be salt-sensitive hypertension, but not always. It can be the other types. 64% higher risk of peripheral artery disease, that's claudication. Okay, 64% higher risk of muscle pain on statins. Maybe you need that statin. It helps some people, not the majority, but you couldn't take it because the statins hurt. That's a sign you're maybe low in vitamin D. It might be worth trying again with a higher vitamin D level, okay? 81% more likely to have a fatal cardiac event if you're low in D, and 300% more likely to have postmenopausal hypertension. Blood pressure problems after the change. Adding 2,000 units to a statin drug, you know, Crestor, Lipitor, you hear of them all the time, reduces cholesterol an additional 29 points and triglycerides an additional 37 points. Makes the statin drugs more effective. Isn't that amazing? Just a little extra D. 4,000 units a day of D lowers blood pressure significantly. It's about 4 millimeters mercury systolic and about 1.5 diastolic. 1,500 units a D is not enough to lower blood pressure. Studies have shown this. But at 4,000 and up, we begin to see a lowering of blood pressure. 4 months of 4,000 improves heart failure ejection fraction. So vitamin D can help heart failure, but it takes some time. It takes a higher dose. Neurologic effects of vitamin D deficient, behavioral abnormalities, including depression and autism. Austrian Journal of Psychiatry, 1,500 units a day improves response to antidepressant medicines. You know, every 10th American is on an antidepressant, and many are on 2 and 3. Add a little vitamin D, it works better. I find it hard to imagine people who are stressed and have a tough time in life with bad events, you know, most reactive depression to our life's events, that taking 2, 3, and 4 antidepressants is in your interest. Add some vitamin D. Add the omega-3s. How about B complex and B12? Perhaps a little SAMe, St. John's wort, probiotics. These all help with your depression. Less medicine is usually best. A 30-year study, low vitamin D triples the risk of Parkinson's disease. Vitamin D slows the progression of Parkinson's disease. Those with high vitamin D levels, 77% less likely to develop Alzheimer's disease in a 7-year study from France. How would you like an 80% reduction of Alzheimer's disease risk with a 20-cent pill? Isn't that amazing? I'll do it. I'm at risk for Alzheimer's, runs in my family. I am going to maintain a higher level. Seizure threshold drops when you're low in D. Seizure medicines wash out vitamin D. Don't forget that if you have epilepsy. Doctors don't forget that. Low D causes a 59% increased risk of macular degeneration. Vitamin D slows the progression of MS. There are several very large studies going on right now to better understand the role of vitamin D therapy in multiple sclerosis. Don't wait for it. Taking vitamin D is safe. We'll tell you how much in a minute. Here, musculoskeletal, let's get to this before the break. Wake Forest, 30 nanograms, if you can get it up to that level, and you can, it's easy, 30% more likely to have more mobility issues if you're below 30. You're going to be the person on the mobility assisting device at the grocery store if you're low in D. That's how this happens, folks. We're learning this. 3/4 of hip fracture patients, half of all patients undergoing orthopedic surgery are deficient. Orthopedic surgeons are recommending 2,000 to 4,000 units for 4 to 6 weeks prior to surgery. Over half of spinal fusion patients have D levels so low their spinal cord and nerve roots are inflamed, compromising their progress postoperatively. 80% of emergency room presenting orthopedic surgery. You're in a car wreck, they rush you to the emergency room, you need orthopedic surgery, it's an emergency. 80% have vitamin D levels so low it compromises their healing. Talk about chronic pain. If you're in chronic pain, you are probably low in D. We have a break. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. And today, when you buy one bottle of vitamin D at the regular price, you'll receive a second bottle free. That's right, buy one and get one free.
Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
That's special once again. Today only, when you buy one bottle of vitamin D at the regular price, you'll receive a second one free. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128 or order online at bioinnovations.net. Ask about the AutoShip program for additional savings.
Here is our hope for you today. I'm Cindy Becker. Christian counselor Dr. Henry Brandt wrote, "To dwell above with the saints we love, that will be grace and glory. But to live below with the saints we know, well, that's another story." Throughout our lives, we encounter difficult people. These souls challenge the best of us. But the Apostle Paul suggested that we maintain our grace in spite of the actions of others. Paul wrote, "If it is possible, as far as it depends on you, live at peace with everyone." Paul acknowledged it may not be possible in all cases, but we should still do our best. Try to look at difficult people through Christ's eyes. Remember his sacrifice was for everyone, even those saints we know who challenge us. I'm Cindy Becker. This is our hope for you today.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone, talking about vitamin D. Such amazing information. And to help you get the D you need, we have a great special today. Buy one, get one free on the Dr. Becker's Bionutrients Vitamin D3, either the 1,000 unit size or the new 5,000 unit size. That way you can pick what's right for you. Now, Richard, I know it's so important to get these levels up, but you have a few more stories that you wanted to share.
Well, it may be this viewer's problem that we need to get to. Proximal muscle weakness. Seniors, have you been prone to falls? You know what happens when a senior falls? They may break their hip, and that's a tough go there. Well, when you're low in D, you lose that core strength that holds you up and keeps you strong and on your feet. 4,000 units a day given to the elderly improve muscle strength and size. It makes a significant difference. However, giving high doses to young, healthy men with sufficient levels doesn't increase their muscle strength, and that's important. Remember, D is also a hormone. There is no anabolic steroid effect to vitamin D. It helps those in need, but it doesn't supercharge muscles in the healthy. That means there's not going to be side effects. That's really what I'm getting at, okay? So if you are weak, and if you're low, it's going to help improve your strength. Here's one. Increasing your vitamin D level helps degenerative joint disease of the knee. How many people, they don't want to do the joint replacement surgery, but they hurt every step. Vitamin D will help you with that. It reduces the pain. Human study. Vitamin D helps to counter the side effects of drug treatment and HIV. Some of the antivirals cause osteoporosis. Maintain a high vitamin D level, you're less prone to get that osteoporosis because your therapy can go on for decades. That's important. Pay attention. Fibromyalgia. Intimately linked to vitamin D deficiency and magnesium deficiency, both. 70% of those who are deficient in D who have fibromyalgia improve dramatically. Add the magnesium, add curcumin, probiotics. Now you're on a holistic program. You can get much better, but it takes some time. 4,000 units a day will help you lose weight faster if you're obese. Double-blind, placebo-controlled study, you know. That's golden evidence, folks. Vitamin D deficiency in children and pregnancy, this one's important. 7 out of 10 pregnant women in North America do not get enough vitamin D. You are at increased risk for genitourinary infections that can lead to preterm delivery. Group B strep, I shouldn't have to say anything else to you, doctors. Yeah, vitamin D helps to prevent that type of thing. Vitamin D deficiency leads to stunted growth in children. In a study among malnourished, if you give mother 5,000 units a day in the last trimester, it assured the baby lived and grew to its fullest potential. They grew enough. It doesn't make a well-fed baby grow extra tall, but it brings you up to your potential. Make sense? Children taking 1,200 units a day are 64% less likely to get influenza, 50% less likely to have an upper respiratory infection. I'm going to ask if my grandkids would rather have D, if I ever should have some, be so blessed. Children with low D are 2.5 times more likely to have peanut allergy. You know how serious that can be. Deficiency in D, 34% increased risk of early menarche in young girls. It's a full half a year difference. Early menarche, first period early in a girl, leads to risk of breast cancer, ovarian cancer. It's not good. The young ladies need a little more time, and we have all these pollutants that have a hormone effect that it's inducing, and obesity, inducing early menarche. This is not a good thing. Vitamin D helps to delay it. It's in their interest to delay it a little bit. Vitamin D, children of vitamin D deficient mothers are more likely to be overweight. Mothers with low D are more likely to develop gestational diabetes and preeclampsia. 400 units during pregnancy reduces C-reactive protein. It helps prevent gestational diabetes, just 400 units. Low vitamin D during pregnancy increases the baby's risk of diabetes 200%. Diabetes, let's talk about that. Type 2 diabetics are classically low. It creates a 95% increased risk of diabetes. If you're low in diabetes, overweight, you're much more likely to become a diabetic. Over 95% of those with blood levels over 18.5, 95%, just sufficient at 18.5, you remain diabetes-free. Inverse relationship between vitamin D level and diabetes risk. You can dramatically reduce that risk of diabetes. Now, the next question would be, which we didn't know up till recently, if you are diabetic, does taking higher levels of vitamin D help to control your disease? Yes, it does. The American Journal of Clinical Nutrition. They gave 100,000 units over 42 days. That equals about 2,400 units a day. And what it did for the diabetic type 2 is this. It reduced fasting blood glucose, it reduced insulin levels, it reduced LDL cholesterol and total cholesterol, along with the general markers of total body inflammation, okay? If you can get your blood level to 35 nanograms, you will receive those benefits, just as they did in the study. Take it a little higher, there's even more benefit. Swiss study, and a single dose of, here, this one's important, so I gotta slow down and get this to the diabetics. Type 2 diabetes, a single dose of 300,000 units of vitamin D3. Now, everyone's going, wow, that's huge. It's not that much. That's what we learned from this. It's safe to do that. A single large dose, boost it up. What it did was it decreased, see, all the diabetics in this study had foot ulcers. You know the foot ulcer can lead to amputation. You know, it's a bad scenario. So they gave these diabetics who presented with foot ulcers a big dose of vitamin D. And they looked for several parameters. And they were able to show with a high dose of vitamin D, it better controlled their blood glucose. And it turned on the mechanism to lay down new repair bone. It turned on that mechanism, which is exactly what they needed. Their hemoglobin A1C reduced, their insulin resistance reduced, and their 24-hour urinary protein, a measure of kidney damage with diabetes, that improved too. So diabetics, you can hit yourself with a good heavy dose of vitamin D to get it up and then stay on a lower maintenance dose and you get all those benefits. Wow, it's just amazing, isn't it? Now, the questions that remain are, how much should I take? How long should I take it? And we will do our best to answer those when we return. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient.
BioInnovations brings you Dr. Becker's BioNutrients Vitamin D3. And today, when you buy one bottle of vitamin D at the regular price, you'll receive a second bottle free. That's right, buy one and get one free.
Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
That's special once again. Today only, when you buy one bottle of vitamin D at the regular price, you'll receive a second one free. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128 or order online at bioinnovations.net. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Are you looking for a way to lower your risk of Alzheimer's? As the prevalence of obesity and metabolic syndrome continue to increase, researchers have found a possible link between type 2 diabetes and the onset of Alzheimer's disease. In fact, type 2 diabetics are at 200% higher risk of Alzheimer's compared to people without diabetes. These metabolic changes that develop with diabetes appears to greatly increase the speed of deterioration of the brain and other related systems. Lowering your blood glucose is easier than you may think. Eat smaller meals, exercise regularly, and reduce carbohydrates in your diet, especially simple sugars. Taking steps today to control your blood glucose may protect your entire body, including your brain. For Your Health at a Glance, I'm Dr. Richard Becker. For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and Cordyceps sinensis.
At BioInnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom Cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. Just a quick reminder to help you get the vitamin D3 you need in your nutritional plan. We have two specials today. This is just fantastic. We have the Dr. Becker's Bionutrients Vitamin D3 1000 IUs at buy one, get one free. Or we have the 5,000 IU size. This is great. This is a new product for us. That's going to help you not have to take so many pills and to be able to bump up those levels to what you need. So either one you get, you buy one bottle at the regular price, you get the second bottle free. Now, Richard, there were a few miscellaneous studies that were quite interesting.
For the diabetic, if you take 50,000 units a week, 50,000 a week, okay, it will lower your blood pressure around 11 systolic and 4 diastolic points. Trials at lower doses, it did not lower blood pressure for the diabetic, but at 50,000 a week, it does. And that's safe to do. It helps to treat gingivitis, helps to prevent and treat. It really helps dysmenorrhea, endometriosis, difficult menopause. Remember, vitamin D controls hormones. So if you're having tough periods, young ladies, this is going to help you. Boost that vitamin D up. It really helps. It also helps with rapidly progressive emphysema and asthma, and they've been able to explain the mechanism. If your lung condition's decaying rapidly, you are most probably profoundly deficient in vitamin D. Get on a higher dose. Here's one I think everybody needs to know. The world's a polluted place, right? We all understand that. They have learned that vitamin D regulates a major portion of your detoxification system. So if you're on a good, healthy dose of vitamin D, those pollutants, you're not going to have as much of it in your system. You'll be able to deal with it and get rid of it better. Isn't that amazing? All from the sunshine vitamin. Who knew? Well, this is what we're learning. Okay, how much do we take? 10 tanning bed sessions, 30 minutes each, equals a dose of 60,000 international units, or about 2,000 a day, and we're told not to go to tanning beds. So that's not a good idea. Being out in a bathing suit until you're pink, depending on your size, creates 10,000 to 250,000. So nature tells us right away taking a large dose isn't that bad. If you're off vitamin D for just 30 days, your level will drop down to insufficiency. Don't go without this nutrient. You need it. 40,000 a day for 3 months. That's a high dose. 40,000 for 3 months will put you near the toxic. So don't do 40,000. That's too much. 1,000 a unit barely raises your blood levels. 4,000 units a day leads to 34 to 40 level in 90%. So I recommend for all of us 4 to 8,000 international units of vitamin D3 a day. 4 to 8 depending on your size, your obesity level, and the medications you take. Infants should take 800. That's more than the Association of Pediatricians recommends, but this is the new information. Infants need 800, adolescents 2,000. And I am thrilled to get the larger size, so you can do a regimen like 50,000 every Sunday, you know, once a week. Or you can take it once a month if you want. Whatever makes it easiest for you to comply to get that good, strong, above 40 level of vitamin D, 40 nanograms. And remember, 25-hydroxy cholecalciferol is your test level. That's what the doctor checks for. And it's always best to get a level so you know. And then get on your therapy, and maybe in 3 or 4 months you check it again to be sure you're around that 50 mark. Then you're going to get all these benefits without the risk of any of the side effects. Thank you so much for your kind attention. I hope I convinced you today to increase your vitamin D dose. Thank you for joining us. We'll see you tomorrow.
Thanks, everyone. We'll see you tomorrow right here on Your Health.
Hippocrates once said, "Let food be thy medicine and medicine thy food." So why do 9 out of 10 of us not eat enough vegetables daily? It's because we don't always know how to incorporate this practice into our busy lives. Instead of removing bad foods, start by adding healthier foods you prefer. You'll soon discover better foods you love will crowd out unhealthy cravings. It's not crazy, just healthy.
You know, the world is changing. You watch it on television every day. It's unbelievable. It's unthinkable.
Today on Love a Child, we are helping people. No matter what is going on all around the world and all the bad reports you hear, there's good reports happening here.